Imagine this. You wake up one morning. You reach for your phone. You hear nothing on one side of your ear. No pain, no warning, just silence. Would you ignore it? Or would you treat it like the emergency it really is? Welcome to Nasmamli O, where we break down real medical conditions into life-saving knowledge. In today's topic, we'll be talking about something so many people underestimate: sudden sensorineural hearing loss. This is not just blocked ear. This is not wax. This is a medical emergency, and every second matters. I will tell you a story, and this is a real life story. A patient walked into a hospital saying, "My ear feels blocked. I think it's wax." They waited. They tried home remedies. They even used eardrops. 3 days later, they finally came in. But by then, the hearing loss had become permanent. And the hardest part, they said, "I wish I had come earlier." What exactly happened? Inside your ear is a tiny spiral-shaped structure called the cochlea. This is where sound vibrations are converted into electrical signals your brain understands. But here's the problem. These cells are extremely delicate. Once damaged, they do not regenerate. Sudden hearing loss happens when blood supply is interrupted. Inflammation damages the nerve, or viral infections attack the inner ear. And it can happen just like that. Every second counts, and this is why. This is where many people make a dangerous mistake. They wait. They think, "Let me sleep on it. It will clear." But here's the truth. The first 24 to 48 hours are critical, very critical. During this time, treatment can reduce inflammation, restore blood flow, save those delicate hearing cells. But 72 hours, the chances of recovery drop significantly. This is why time is hearing. There are signs that you must never ignore. If you experience any of these, act immediately. Sudden hearing loss in one ear, muffled or distorted sounds, ringing in the ear, otherwise known as tinnitus, dizziness or imbalance, a sudden pop followed by silence. Do not assume it works. Do not wait for it to pass. This is your body sounding an alarm. So what happens when you go to the hospital? When you go to the hospital, the doctors will perform hearing tests, examine your ear, and rule out blockages. If it's sudden sensorineural hearing loss, treatment may include steroids to reduce inflammation, sometimes injections into the ear, and blood tests or scans if needed. The goal is simple. Save your hearing before it's gone forever. And every delay comes with consequences. When treatment is delayed, the effects can be life-changing. There may be permanent hearing loss, constant ringing, which is tinnitus, difficulty communicating, social isolation, or even anxiety and depression. Imagine losing sound permanently because you waited. There are common myths, and let's clear some of these dangerous myths. It's just earwax. It will come back on its own. It's not serious because there is no pain. Pain is not required for an emergency. Silence can be just as serious. One moment, one decision. You either act fast or you live with silence. Sudden hearing loss is not something to wait on. It is a race against time. And in that race, every second counts. If this video has helped you, share it. You could save someone's hearing. Subscribe to Nasmamli O for more real medical insights that matter. Stay aware, stay informed, and always listen to your body. And before I leave, I'd like to share with you one of the life experiences I witnessed something close to this. I know of someone who had this tinnitus and a sudden pop, but the person actually went to hospital immediately because they thought something really terrible had happened to their ears. And then the doctors checked the ears and they discovered it was what it was. So she got the treatment, and because it was diagnosed early, the ear was saved. Thank you for listening, and thank you for stopping by. Please follow Nasmamli O for more information. Remember, this channel is for education purposes only. If you feel unwell or have a problem with your ears, please visit your nearest health facility and stay safe. Goodbye.
Life goes on, life goes on. It's the most simple thing I ever learned. It's the most common thing I ever heard. It's the most obvious thing I ever observed.